Hi, everyone. My name is Keira St. George, and I'm really happy to be here today presenting to you my culminating project. My practicum was with the overdose response team at Island Health, and my project focused on youth drug poisoning overdose fatalities. So I would like to begin just by acknowledging that I am a white settler and an uninvited guest, and I give thanks to the Coast Salish, the Nuu-chah-nulth, and the Kwakwaka'wakw peoples on whose traditional territory I live. Indigenous people continue to be staggeringly overrepresented in toxic drug poisoning deaths in BC, and there continues to be a need for decolonizing and indigenizing health services. So it's no surprise the public health issue at hand here is overdose fatalities and the drug poisoning crisis. BC is now in year 6 of the public health emergency, and we still see overdose fatalities rising. Youth so far have had little focus, but they are uniquely vulnerable due to their stage of brain development and also their susceptibility to stigma, shame, and fear that can result in risky drug use behaviors. When we consider the potential years of life lost and the unique socio-emotional traumas that are associated with youth who die, they do warrant enhanced attention. And there was also the question at Island Health that there may be increased youth overdose fatalities here than elsewhere in BC. And so it's through this suspicion that my project focus took shape. My project consisted of 3 main pieces. First, a literature review, then a retrospective review, and evidence-based recommendations, and those are what's underlined in the graphic. At the beginning of my practicum, we formed an advisory group that consisted of internal stakeholders, and we talked about project options and goals. And once we determined that a retrospective review was the ideal way forward, I then conducted the literature review that would inform the design of the retrospective review. I conducted the study and then analyzed the data and reviewed the findings, which then informed the recommendations. So the literature review included looking at over 400 articles for relevance to youth substance use and overdose. There was clear focus on risk and protective factors in the literature, as well as key themes related to healthcare interactions and service gaps. As this table shows, early life protective factors do largely relate to family and home. So this includes a stable, safe, and supportive environment with family connectedness and parental guidance, in particular guidance around substance use. And then in later years, protection is also added from social environments, school interaction, and positive mental health. On the other side are the primary risk factors, which include trauma. So this comes particularly in the form of adverse childhood experiences, such as abuse and maternal violence. And these do have a well-established link with the development of mental illness, and substance use. And as for health system interactions and gaps, 5 key themes emerged in the literature. First is relates to providers, and that has to do with unfamiliarity with youth substance use care and guidelines, as well as delivering screening and intervention. And despite being widely recommended, early intervention is underutilized with few youth-specific guidelines. And we also know that youth and substance using populations do have high frequency of emergency care access, but the evidence shows that there are vast discrepancies in care with youth and multiple missed intervention opportunities. And there's also a known link between prescribing opioids and developing problematic substance use, and also a lack of clear prescribing guidelines for opioids in youth. And finally, for treatment, there are few youth-focused treatment resources available, and the few that there are underutilized by youth. So for the retrospective review, the study goal was to examine illicit drug toxicity deaths in youth aged 19 and under in Island Health from January 1st, 2019 to December 31st, 2021, to see if there were any common factors. It was approved by the Harmonized Ethics Review Board of UVic and Island Health, and a purpose-designed data collection form was used, collecting data from all available electronic records in Island Health. Because this was such a small sample, data was primarily descriptive, in the form of measures of central tendency, but we did also calculate inferential statistics. But because it was so underpowered, this meant that there was lacking of statistical significance and generalizability. This data, though, could be used to inform future larger studies. So for the results, they do align with previous evidence. So similar to data from 2016, provincial data, Indigenous youth are overrepresented at 25% of the sample. And because this data wasn't actually routinely collected, I presume that this is underrepresented. The significant impact of home and family life on youth risk is clear. The majority of youth came from homes with separated parents, Ministry of Child and Family Development involvement, and stable chaotic environments and adverse childhood experiences. Nearly 2/3 of the sample had a mental health diagnosis, and 2/3 also had poor interactions with and attendance at school. So this includes being suspended or expelled. And an incidental finding is that nearly 1/3 reported the recent death of a friend from overdose. And then of particular significance to Island Health is the confirmation that youth have higher frequency of emergency care access, with 3/4 of those being seen within 12 months of death, and half of those having 3 or more visits each within those 12 months. So for key findings, really this does mirror what was found in the literature review. So protective factors are largely absent, and major risk factors are prevalent. Future research should consider whether or not the recent death of a friend from overdose is in itself a risk factor for fatal overdose. There was no evidence of substance use screening, but high frequency of emergency visits. There was also a lack of bed-based substance use or concurrent disorders treatment referral, probably because no such facility exists on Vancouver Island. And aligning with its existing evidence, findings did show that female youth might have greater odds of having not only an anxiety disorder and suicide-related experiences, but higher rate of reported previous overdose. So this is important for future research because if these sex-specific risks might aid clinicians in risk assessment and clinical decision-making. And then with 26% of BC's youth overdose fatalities in 2020 and 2021 combined occurring on Vancouver Island, this does confirm that youth deaths on Vancouver Island are disproportionately high, and a larger study should confirm statistical significance. So 5 recommendations were presented to Island Health. First, implementing universal standardized screening for youth substance use using a validated tool in all settings where youth engage. Second, integrating routine evidence-based education and awareness on protective and risk factors, screening and intervention delivery. Third, create an evidence-based organizational protocol for youth pain prescribing practices. Fourth is to implement a policy that supports youth admission for high-risk youth presenting to emergency that allows for care planning and discharge plan follow-up. And finally, to create a bed-based treatment facility for youth substance use or concurrent disorders that is low threshold and developed meaningfully with youth. So I've presented this internally to the advisory group and other stakeholders, and also shared the report with external agencies and partners. I'll be presenting next month at BCCSU conference, and eventually hoping to pursue journal publication of this. So just a quick reflection for me, one of the major strengths of this is the relevance to the current public health issue, and that this is in its 6th year of a public health emergency. And there were a few challenges. The biggest one for me was actually the content. I really didn't think I would struggle so much with witnessing sort of as if in real time, reading through all these encounters of youth with decompensating mental health, disturbing family experiences, and experiences of trauma. It was an unexpected part of the process for me. And finally, many people made this project a reality, which I'm really grateful for. And two of my colleagues are listening right now today, which I'm really grateful for. I particularly like to thank Sandra Allison, who's at MHO with Island Health, who was the principal investigator on record for this study and really was a great champion of the work, and my supervisor, Carlin, who just believed in me and advocated for me and trusted my independence, which was really great. And finally, I need to acknowledge all the youth who died. Every time I practice this, it was so hard. I experienced their pain and the chaos of their life, and it was so private, and they'll just really stay with me. Yeah. Thank you.